Everybody. Thank you for joining us this afternoon for our fourth regional town hall focused on the Hubs and Spokes initiative. A couple of logistics items before I pass it off. Participants will be muted during presentations, but we are saving time at the end to hear from you. You can use the raise hand icon on your Zoom toolbar or the Q&A icon to submit questions and comments. Closed captioning as well as ASL are available. You should see our ASL interpreter, Kim, on your screen. Closed captioning does need to be enabled, so you can hit the closed captioning icon and enable or show subtitles to get that going. The presentation and recording will be archived. You can visit the California Department of Aging's YouTube channel or the Hubs and Spokes Network webpage to access not only this session, but past sessions as well. And Connie, I will pass it off to you.
Thanks, Maria. Good afternoon, everyone, and thank you for joining. Like Maria said, this is our fourth town hall that we have hosted. So you'll see we have a series of stakeholder engagement opportunities that we've had over the last few months. This is the fourth and last town hall that we'll have. We do have a feedback survey as well that is still open until this Friday. We did just get it translated, so it's also available in Spanish as well. The Spanish version will be available until the end of October, but we request any English participants that are taking the survey to complete it by the 15th. Also, we welcome any written recommendations via email. We are looking to host a results and recommendation briefing mid-December is what we're looking at. And next slide, please. All the information can be found on the CDA webpage. Under our highlight section, there will be a direct link to the Hubs and Spokes Initiative webpage. There you'll find all the resource information and also links to previous town halls and the Leadership and Aging webinars, as well as the survey as well you can find there. Next slide. And just briefly, what next steps mean. Again, the engagement opportunities, we're asking for everyone to submit their feedback through October 15th, which is this Friday. California Department of Aging and California Commission on Aging will be hosting the results and recommendation briefing in December. This will be done in partnership with Sacramento State University. So we'll be working with them where they will help us analyze all the information and themes and feedback that we've gotten throughout all the town halls and the webinars and via through email or regular mail. And that will lead us to the results briefing in December, where we can all talk about what has been heard at all these town halls and the webinars, and talk about next steps and what these recommendations may be, or what the next steps may be. And that could include, is it state bills we should look at? Is it, are there budget issues? Are there, local actions that we can develop and advance? Next slide. So we've got a quick poll today that you should see on your screen. We just wanted to see really quickly who's joining us today. So if you can just take a quick minute to answer that poll, that would be great. And we'll go over the results shortly. I'll go over the agenda really quickly. We have a packed agenda today. So first we'll go over a little bit background, just the opportunity for California as we build back better. A little brief background about the vision, what the Hubs and Spokes for Aging and Disability in every community looks like. And then we'd like to hear from a couple local perspectives, which we're excited to hear about. And then most importantly, we want to have the public discussion, the second half. So it looks like, let's see, as folks are completing the poll, we'll share the results. Looks like a lot of different folks are joining us today. We've got a good percentage of service providers, representatives from area agency on aging, and also representatives from local city and counties, and also advocates as well. So welcome everyone. So now I'd like to toss it over to Mr. Joaquin Angera to Building Back Better.
Good afternoon. My name is Joaquin Angera. I've been involved in the field of aging for 45 years. I feel privileged to have seen the development of aging networks since their beginning. With two other persons, I wrote the proposal that created the San Diego County Area Agency on Aging. That was back in 1973. For most of the time, I worked in various positions in aging programs. And later, I was lucky to teach several gerontology courses at San Diego State University. I have been a member of the California Commission on Aging since 2016. And I am pleased to represent the Commission today at this town hall. The California Commission on Aging is an independent state advisory body to serve as the principal advocate for older Californians. The Commission's mandate to provide input to the governor, state departments, and the legislature gave us a unique opportunity to be an integral part of the development of the Master Plan on Aging. And now for us to get involved in its implementation and monitoring. The Commission supports the Master Plan on Aging initiatives focused on strengthening leadership at the local and state levels, including revisiting the local structure, which happens to be the focus of today's town hall. But to be clear, the Commission has taken no position on how the local area agency on aging, the AAA's structure, might be reconfigured. I am here to listen along with and partnering with the California Department on Aging. Next slide, please. As you know, nowadays more and more diverse Californians are living longer. We could say that getting older is becoming fashionable. And why? It's because the number of older persons continues to increase. By 2030, the over 60 population will exceed the population 18 and under for the first time in our nation. There were two recent nationwide polls by the SCAN Foundation and AARP that confirm many of the things that we already know. Basically, that people, as they get older, they want to continue living in their homes and in their communities as they age. Also today, older adults approach their retirement years much differently than earlier. Many of them want to continue an active lifestyle, either by working or by volunteering. Many of us are caregivers, caring for a family member or raising our grandchildren. And we provide some of the most important volunteer services to our community. Next, please. The last 2 years have been an unprecedented and historic period for older adults in California. The convergence of three factors that will be highlighted in this slide that are highlighted offer us a once-in-a-generation opportunity to build back better with a system that connects people to services that allow them to live with dignity and independence in the homes and in the communities of their choice. First of all, of these factors is the recent COVID-19 pandemic, which created an urgency to address disparities and gaps in health and human service delivery systems. Today, we have an opportunity to learn from advances in technology. We all learned how to use Zoom, myself included, the acceptance of telehealth, innovative partnerships for meal delivery, new housing alternatives, and healthcare without long-term services, with long-term services and support. Second happening was that we have developed a thoughtful master plan for aging. informed by thousands, I'd say, of hours of stakeholder interested persons, contractors, and also state staff work. And the dynamic leadership of the former CDA director, Kim McCoy-Wade, who has now been appointed senior advisor to the governor for aging, disability, and Alzheimer's. The CDA exceptional team and Secretary Galley at the Health and Human Services Agency. And finally, we have the extraordinary federal and state investments in home and community living services, in workforce, in infrastructure. These are exciting times, and I'm hopeful about the future, and I look forward to a dynamic and informative discussion. And now I'm pleased to hand it over to Acting Director of CDA, Mar Beckley.
Right, thank you so much, Joaquin. And I just want to say that CDA is so happy and pleased to be partnering on the Aging Hubs and Spokes initiative with the California Commission on Aging. So definitely very exciting times that we live in, as Joaquin had stated. Unprecedented levels of investment in aging and disability programs. So it's a really exciting time, I think, for all of our programs. As Joaquin had stated, I am currently the interim director of the California Department of Aging. We will have a new director starting November 1st, Susan Damaris, who many of you are familiar with from the Alzheimer's Association. So really looking forward to having Susan on board with us soon. So I just want to start off by talking a few minutes about what this Hubs and Spokes initiative is all about and why we're here today. We're here because the stakeholders that were involved with the development of the master plan for aging felt it really important that CDA take a look at the leadership structures across all levels of government, at the local level, at the state level, and even partnerships at the federal and the international levels. In particular on this slide, you'll see three key leadership initiatives that were called out in the master plan for aging process. The first is to focus on area agency aging local leadership structure, or Initiative 101. A related but separate initiative is to build out a statewide no wrong door system in California, Initiative 98. And this change in leadership is happening both at the state and local levels. As Joaquin had mentioned, our former director, Kim McCoy-Wade, has been appointed the new governor's senior advisor on aging, disability, and Alzheimer's services. This is a tremendous opportunity for all of our programs to have such a strong advocate in Kim in the governor's office, and we wish Kim well in her new role. Next slide, please. So why did the stakeholders in the master plan for aging recommend that we focus on leadership? What problem are we trying to solve? You know, I think that this single picture really captures the fundamental issue identified by the stakeholders in the master plan for aging development process. What we see is too many consumers experience looking for aging and disability services for themselves and for their loved ones, like the picture on the left. This picture has lots of arrows, lots of doors, lots of referrals, as someone attempts to search for services and supports in their area, such as home care, meals, transportation, legal services, and respite care. And the vision that we heard from the Long-Term Services and Support Subcommittee, as well as the Governor's Alzheimer's Task Force, chaired by Maria Shriver, was a need for a statewide single point of entry to the entire array of services and supports that our communities have to offer. This includes services offered by public, private, and nonprofit entities, and at the city, county, regional, and state levels. So the key question is how can we make these services more readily available and accessible to all Californians? So that's the vision we heard. And the key question that faces us now is we as leaders in aging and disability programs, how do we deliver on that? Next slide, please. As Connie laid out, this conversation is about a potential framework that we could potentially adopt as a state and move forward together. And what I really want to make clear at the outset is that this is a proposal for a discussion. No decisions have been made. Nothing has been set in stone. So we really are interested in hearing from you, hearing all of your ideas and your input in our framework. And as Connie had mentioned, at the end of the process, we'll take all of your recommendations, compile them into a report, and then present them back to the group. So this is what we're proposing: a concept of a statewide foundation and framework for every local community to adopt, with the goal of delivering person-centered, equity-focused, and data-driven services and outcomes to all Californians as we age. Okay, next slide, please. So I know that's a pretty general description, so let me get a little more specific. This slide describes what a concept for a framework and a foundation would look like. Let's start at the bottom of the slide. For there to be an effective aging leadership across the state, there needs to be a key partnership at the local level among three key partners: the local area agency on aging, the county adult services department, and community-based organizations in aging and disability. For this last group, this includes several different types of providers, such as independent living centers, Meals on Wheels providers, legal services, family care organizations, and many, many other nonprofit partners that are essential to delivering services to older adults and individuals with disabilities. This three-way partnership is really the foundation of building this framework. So let's move now to the top of the slide. We propose 6 common features that could be shared by state and local networks. Going from left to right, we have the one-door ADRC system that many of you have heard about. This would be a person-centered entry point into aging and disability services. The vision is to create one common brand so that there's instant name recognition and association with the array of services that our communities have to offer, which would also include a single statewide telephone number and a web page that individuals and their loved ones could use and contact if they need services. So, I mean, I think you can think of models developed by First Five, Covered California, and other successful statewide service models. Then behind it is a comprehensive systems of spokes of all the services that a community has to offer. I'm really interested to hear today from our partners in Southern California about the work they've done to build out spokes or different service offerings in their communities. And what's really important to remember and understand about this framework is we're not talking about just services delivered by one individual AAA or one county department or one nonprofit provider, but a truly comprehensive system comprised of a variety of different partners and providers that work collaboratively together to deliver person-centered services that serve all of our needs as we age or as we live with a disability. A third feature that we can all align around is quality. It's great that we have a vast array of services to offer, but what's the quality of the services that we're actually delivering? And what are the outcomes that we're searching for? Our goal always is to create person-centered, data-driven, and equity-focused services. And how can we move beyond the initial referral to true person-centered services that include comprehensive needs assessments, care coordination, successful transitions, and continuous support? So once you get through that front door, there needs to be a quality service delivery system behind it. The fourth key piece is partnerships. In addition to the key partnerships that I spoke about earlier, there are 3 additional partnerships that we intend to lift up. The first is health plans. This is an emerging area as Medicaid goes through CalAIM and as California looks at Medicare integration. How can we help health plans pay for more home and community living services that support health and can prevent institutionalization? The second key partnership is emergency services. Unfortunately, California lives in an era of wildfires, climate change, and power shutoffs. We need to closely and continuously partner with our friends in emergency services to ensure that we're all adequately prepared for emergencies, especially the most vulnerable among us. And the third key partnership is our historic partnership with over 100 federally recognized tribes in California that serve our first elders. All right, moving again along our continuum, the fifth piece on our continuum is the essential backbone of technology and administrative services. We're currently in the process of working with our AAA network to migrate them off of 4 different computer platforms into one platform, and CDA will also be joining this single statewide platform. The goal of this platform is to get faster access to data, to make quicker, better data-driven decisions, improve and expedite data reporting, and build better public transparency for our data so everyone can see all of the great work that we're doing and the progress that we're making in developing and expanding our programs. And then finally, in the area of administrative services, we need to increase our program resources to serve the growing and diversifying California population and cut the administrative burden associated with our programs, whether that's in contracts or subcontracts or monitoring that's not leading to meaningful results. So overall, our goal is to increase the amount of resources available to our networks and to reduce the administrative burden so that we can more effectively and efficiently focus on core program services to older adults and individuals with disabilities throughout the state. Okay, so in a nutshell, that's the hubs and spokes concept. We do have a few questions that we'd like you to consider as a group. Does this framework make sense to your community? Does it connect with you and can you align with it? If you can align with it, what type of support would you need to implement such a framework? And is there anything in the framework that you would change? So I think what's really important during this listening period, as CDA has proposed the framework and is now taking a step back to listen through these town halls, please be frank, please be open, and provide us with your best thinking in terms of what can make for a stronger, more formidable framework that we can all move forward together and improve all of our programs collectively. So speaking of listening, what I'm especially interested in listening today is from our speakers. So our first speaker is Laura Trejo, who is the LA City AAA Director. Laura has just such a vast amount of experience in aging and disability programs and has really been innovative and on the cutting edge in expanding services in LA City. Our second speaker is Paul Downey, who's the president and CEO of Serving Seniors, who provides just tremendous services to seniors throughout Southern California. So without any further ado, I'll hand it over to Laura now.
Thank you, Mark, and good afternoon, everyone. Thank you to the California Commission on Aging and to the California Department of Aging for inviting me to share our vision and our work here in Los Angeles. First slide, please. I prepared a slide with lots of data, but the one thing to keep in mind is that aging is a dynamic process and that no two people age the same. Los Angeles as a region is home to one of the nation's largest concentrations and most diverse concentrations of older people in the country. Only 10 states have an older adult population larger than Los Angeles County, and is quickly becoming one of the most diverse. Just to give you a sense of our population, the city of Los Angeles currently has the level of diversity in its older adult population that California will have in 2030. So we're actually a living lab of how to address the issues and the needs of new emerging older adult populations. Next slide, please. As you can see, I wanted to share with you kind of what is the job of AAAs. Area agencies on aging really address a stage of life that encompasses over 40 years and getting longer every day. It's not unusual anymore for people to reach their 100th birthday. I just recently read a statistic that said that a 13-year-old could expect to live to be 100, which is really amazing to me. But it means that it's really going to challenge all of us to build the infrastructure of aging services that will meet the needs of that 13-year-old in the future. AAAs, while they focus on this span of life, have a lot of functionality. We assess the changing needs of older adults in the community. That is happening on an ongoing basis. We leverage, repurpose, develop, and fund programs. We're constantly trying to be creative in how to deliver the services that our consumers need. We not only provide direct services, we also contract with community-based organizations to deliver those services as well. We serve as a portal of care to other systems. So, for example, clients needing healthcare, clients needing long-term services in nursing homes, etc. We interface with all of those systems and try to influence and advocate on behalf of our clients. We also have the responsibility to effectively and efficiently manage both public and private funding streams. I can tell you at the City of Los Angeles, my department is considered a training ground because we handle so many funding streams in order to fulfill our mission. We also have to ensure that there's a vibrant and relevant provider network to meet the needs of older persons in our community. Next slide, please. This is just to share with you kind of how I see Los Angeles. As you can see, you see the hubs and spokes, and there's kind of a shadow because there are 2 area agencies on aging in Los Angeles. We are unique in California, and there are 2 coexisting in the county. We also have 6 independent living centers. That's also quite unique that we have that many. We have hundreds of community-based organizations that serve older adults, and we have dozens of government agencies that provide services and supports. Just to give you an example, the County of Los Angeles did an actual assessment, and they found over 120 unique services that meet the needs of older people in Los Angeles County. So the level of coordination is quite large and encompasses a great array of service needs that older people face. One of the things that we're in the process of doing right now is we're actually building our aging and disability resource connection for Los Angeles, which encompasses both area agencies. Our dream is to encompass all 6 independent living centers and other partners in our community, including 211 and others. So that was just to give you a sense of what Los Angeles looks at when it looks at its diversity of service delivery. Next slide, please. One of the areas that we're extremely proud of is the work that we started in 2016. As a region, we became designated as an age-friendly community, both city and county. Our vision for Purposeful Aging Los Angeles was to make the Los Angeles region the most age-friendly in the world. We look at the work that we're doing under Purposeful Aging under 4 different lenses. Is the work that we're doing age appropriate? Is it accessible? Is it inclusive? And is it dementia friendly? So all the work that we do must meet and answer those questions. As you can see, part of our work is very dynamic. We're encouraging the other 87 cities to join us. So far, we've had 8, and about 30 have expressed interest. We are working to sort of become a hub that coordinates task forces, affinity groups, etc. We're working with our academic partners. 3 of our universities have now joined the National Network of Age-Friendly Universities, and we're also developing new programs as we move forward. Next slide, please. LA is in motion. There's a lot of activity in our region, given the size of our population. We are on task to basically double the size of our older adult population in the next 8 years. Purposeful Aging has served as a wonderful foundation of our work. But we're also doing a lot of other things that address the unique needs of older people. We are creating, for example, as a result of our action plan with our age-friendly initiative, the County of Los Angeles elected to develop a comprehensive Department of Aging. We're really excited about that. We have launched with partnership with the Public Health Department, even in the middle of a worldwide pandemic, a Healthy Brain Initiative, looking at how do we become more dementia friendly in our community. As I shared with you, we're building an aging and disability resource connection in Los Angeles. As area agencies on aging, we're committed to aligning our services even closer. So one of our very exciting goals for right now is that we're aligning to create a shared area plan by 2024. So you see, we have a lot of different initiatives in Los Angeles. We are working on the digital inclusiveness, homelessness, food insecurity. All of those have programs and policies and procedures that we're implementing in the local community. We're also looking at our stakeholders, both our Philanthropic stakeholders, for example, I've started discussions with funders. We're also looking at advocates and how do we mobilize the incredible brain trust of our advocates in the community to help us build the future services that we want to see. And we're also looking at how do we better coordinate and more effectively manage the stakeholders that are in the community-based organizations. I can tell you right now we're working with about 200 entities that work with us almost on a daily basis in terms of how do we re-envision, redesign, and imagine the future of aging in Los Angeles. Next slide, please. There are many challenges and opportunities that come along with serving older adults. I think one of the most important things I want to leave you with is that aging is a stage of life, not a social problem. That we need to think about it that way. That we also have to remember that one size does not fit all, and that whatever we're building has to address the unique needs of different populations. Because what we don't know about the aging of our population is a great deal. We are still in a discovery mode. What are older adults going to need from different groups that we're not familiar with? We also have to think about what is the speed of change. Change occurs very rapidly, and a lot of this is occurring at the local level. So to the degree that local communities are part of any process of change is critical for our success. We also have to address growing needs. For example, health disparities. That is an increasing area of our concern. The lack of affordable and accessible housing, the lack of transportation options for older people to stay mobile, the continuing issues of hunger and food insecurity, economic insecurity. We have to look at that. We also have to look at what are we going to be doing about the gaps in local labor force? Will there be people there to do the work that we need done for an aging population? We also have to, and I really appreciate Mark saying it, we have to do a better job in disaster preparedness. You would think that a state that faces so many different types of natural disasters would have better plans. We don't, and we need to work very hard at it. The last opportunity and recommendation that I want you to consider is that most of the time, area agencies on aging are not at the table when state and policy decisions are being made. So my recommendation is that we need to be, as the leaders of aging in our communities, we need to be at all those tables in order for those policy decisions to be effective at the local level. So I thank you for the opportunity, and I look forward to hearing your discussion.
Thanks, Laura. I'm Paul Downey. I'm the president, CEO of Serving Seniors. We're based in San Diego. I've been in my position for 26 years. I'm also the past chair of the California Commission on Aging. I'm a current board member of the American Society on Aging and chair its public policy committee, and serve as the co-chair of the Elder Protection Council here in San Diego, as well as serving on the Continuum of Care Board for the Regional Task Force on Homelessness. So if we go to the next slide, please. So I want to tell you a little bit about serving seniors. We focus on mostly folks living in poverty. 85% of our approximate 10,000 unduplicated clients on an annual basis live below the federal poverty level. Most live in single room occupancy hotels, subsidized housing, or unfortunately, many are homeless and living on the streets. We provide an array of services. Meals, of course, is our big. We in FY21 we served 1.7 million meals, almost 3 million meals since the pandemic began. We had a network of about a dozen senior centers from one end of San Diego County to the others, and of course had to convert quickly to providing homebound and to-go meals. I'm not going to spend a lot of time this afternoon talking about it, but I did just want to highlight the congregate meal program. The pandemic broke it when we had to shut everything down, virtually overnight, convert people to receiving meals at home. We told them to stay home, don't go out, stay away from folks. And then we reopened the state, people started to come back, and then the Delta variant broke the system again. So longer term, there does need to be some considerable discussion about what we're going to do about rebuilding a congregate network that frankly pre-pandemic we're seeing declining numbers in many cases. So that's something that does need some attention. We also provide case management, including mental health care. We have access to healthcare, dental, legal, full safety net of services. We provide homelessness services, as well as transitional housing for people coming off of the streets, as well as over 400 units currently of permanent supportive housing. We're in the process of building a 117 unit complex in the City Heights neighborhood of San Diego. We're breaking ground next year on 172 units in the Claremont neighborhood of San Diego. We find the number one issue for low income seniors relates to housing and homelessness. They're challenged when they're spending sometimes 80–85% of their income on housing and are very precarious about falling over the edge into homelessness. We go on to the next one, please. So I wanted to just touch on, we are very collaborative. So of course we work with San Diego County Area Agency on Aging. We're an Older Americans Act nutrition contractor for the county, which helps fund our meals. But we also work with the County Housing and Community Development Department. We are partnering with them on the project in the Claremont area that I mentioned. That's a county property that we're building housing with a 99-year lease. We also work with the County Office of Homelessness Solutions in terms of we're process of developing a comprehensive plan for the county. We work with the County Behavioral Health Department on mental health challenges. We work closely with the City of San Diego Housing Commission on vouchers, emergency housing vouchers. We have 30 units of transitional housing that we use Section 8 vouchers for, which is they were never intended to be for that purpose, but we worked with HUD and are using them for transitional housing. We work closely with 211 San Diego as sort of they're our local hub, and we're the spokes in terms of help them access the services for their clients. We also work with 30 formal collaborative partners, and these range from Sharp Healthcare, which is the largest health provider in San Diego, to San Diego State University, University of California, San Diego, Elder Law and Advocacy, and a whole host of others, where we bring them into our facilities and they provide direct services in collaboration with our staff. So it's a seamless one-stop shop for resources for very low income seniors. Go on to the next one, please. So I was asked specifically to really touch on the homelessness issue because this is a growing topic, a growing challenge that has not received as much attention, at least from my perspective, as it deserves, and historically has kind of been outside of the traditional aging network. It's always been over with housing and community development and in other areas of government, but there definitely is an intersection with that. So just to give a quick set of basics, in San Diego, according to the 2020 point in time count, over a quarter of the folks on the streets are 55 plus. 88% of those became homeless in San Diego. So friends and neighbors who ended up on the street. That translates into 2,000 people on the streets. So a significant percentage as well as a significant number in San Diego. Just because this is a Southern California discussion, I pulled LA's numbers from the point in time count. 36%, so over a third are 55 plus, 90% became homeless in Los Angeles, and that translates to 15,000 people on the streets of LA are 55 plus. I took a brief look at Orange County, San Bernardino, Riverside, and the numbers are the same. You're seeing anywhere from a quarter to a third. If you look at San Francisco, it's about 40%. So it's a significant portion of the folks on the streets. When we discuss homelessness, quite often you'll hear a lot of discussion about youth, veterans, and chronically homeless. But you don't hear a lot of discussion about older adult homelessness as a focus, despite the fact that the numbers support that notion. So we'll go on to the next one, please. So what we did at Serving Seniors is we were fortunate to receive a $100,000 grant from the Hearst Foundation about a year and a half ago. And we engaged a research firm by the name of Hardering Company to go out and do a comprehensive deep dive needs assessment in San Diego County on older adult homelessness, and to come back with us with results. There were over 400 individuals that were part of that, half of whom were either currently experiencing homelessness or had been homeless at some point, and half were on the cusp of becoming homeless, just literally, a few dollars here or there, and they were going to end up on the street. And the results came back with some interesting data. The first was that we found that older adults are a unique cohort. They really need to be treated differently than the other cohorts because economic issues are the primary cause of the homelessness. So illness for themselves, illness of a spouse, loss of a job, housing costs going up on a fixed income, any number of things that led to the homelessness, but it was primarily economic. The numbers came back with very low incidences of mental health issues and very low numbers who had drug or alcohol issues. It was, again, economically driven homelessness. Second is, we asked them, how much would it have taken to have prevented the homelessness from occurring? Or if you were currently homeless, how much would it take to get you back into a stable housing situation? So we gave them $100, $200, then up to $500 or more. Well, it came back that 56% said all they needed was $300 or less to remain housed versus being unhoused. So we're not talking optimal. We're not talking, Section 8 voucher levels of support. We're talking basic keeping somebody housed. Now, if you compare that, the $3,600 versus the cost of a homeless individual on the streets can be anywhere from $30,000 to $50,000, depending on who you want to talk to. So this was sort of an aha moment for us that maybe this is something that can be done. And we know actually that Los Angeles is currently looking at doing shallow subsidy program. The county there is working with the Salvation Army on just such a program. And so we want to see that expanded in San Diego and then ultimately statewide. We also identified that shelters, the older adults experiencing homelessness avoid shelters. They expressed strong physical fear. They expressed fear of having their possessions stolen, and they were concerned about the drug and alcohol activity that was going on in the facilities. And again, this is an area where the Aging Network needs to come in and become part of the shelter discussion. So one of our recommendations is a simple one, which is to dedicate age-friendly space within a shelter, sort of a shelter within a shelter concept, perhaps more security, perhaps a little bit more spacing, so that if someone is using a walker or wheelchair, there is space, bringing specialized resources into those areas. And then longer term might even be looking at dedicated older adult shelters that would cater specifically to that population. One of the things that came through, and I should have mentioned, we surveyed 40 providers of services to homeless. So these weren't necessarily aging. These were just across the board folks that were involved. It came back that more than half said their case managers had zero training on older adult issues and resources. And so we dug deeper and we found that their case managers didn't know how to access Social Security. They didn't know how to access, or they didn't know when you might call in APS. So some basic information that they didn't have. And so that's a major training area. And again, as we look at things like ADRCs and whatnot, is remembering the non-aging providers that provide services to older adults need to be included, as well as training. We also identified that the current assessment tools are not optimized for older adults. The VIASPDAD is the current primary mechanism for doing assessments for the coordinated entry systems in most communities. It provides, you get a point if you are mentally ill, you get a point if you have a drug or alcohol problem, point if you're chronically homeless, point if you've been in jail, and it's designed to target chronic homelessness. But it doesn't do well for somebody who is economically homeless, who doesn't have all of those things. And so the system has not been doing a particularly good job of providing resources to them. Prioritizing in planning and discussions. Now, fortunately, the master plan does address this issue, but a lot of other training documents and plans in cities and counties don't. If you go to the city of San Diego's website and look up their current plan on homelessness, about 100 pages, and there is not a single mention of older adults, seniors, aging, anything like that, anywhere in the document, despite the fact that actually at the time it was written, it was over 30% of the folks on the streets were 55 plus. So as we look at as an aging network, we need to be at the table in discussions as planning is going on around housing and homelessness issues. And the last one, clearly, we need more affordable housing. That's, I think, evident to most folks. But again, that needs to be part of the discussion within the aging network, and within the housing network, aging needs to be brought in so that everybody is speaking to each other. So I think with that, I think I'm tossing it back for some questions and answers.
Great, thank you both, Paul and Laura, for sharing with us your local perspective. It's been very insightful. We'd like to move on to the comments and questions now. So if we could advance to the next slide. So just to help lead the discussion, we've got a few questions here for you to kind of think about. So how can the state help communities establish a hubs and spokes network for aging and disability in your community? We'd like to hear about, what are some opportunities or what may some of the challenges be in your region specifically? And if you also have any advice or comments that you'd like to share or discuss with, any of the folks that have been speaking today. If you have some questions, feel free you can either raise your hand and we'll unmute your microphone and you can ask it live, or feel free to send it through the Q&A section. You'll find that on the bottom towards your screen. You'll see it says Q&A and you can type in your question there. So let's start off with, it looks like, was our hand raised? There is one hand raised right now. Megan Granata, we'll unmute your mic and bring you in. And if you'd like to ask your...
Can everybody see in here? Oh, good. My Zoom's acting odd. This is Megan Granata. I represent the Orange County Aging and Disability Resource Connection. I'm here as a professional, but I want to make a personal comment. This is the hubs and spokes model for aging and disability, and there are no presenters here from the disability community, and there has been no discussion of disability issues outside of Paul very briefly mentioning shelter accessibility. And as a person with a disability myself who uses these services and plans to use this network, it kind of broke my heart. So I want to ask, I know we've had a lot of conversation around potentially adding independent living centers as part of the hub and the hub and spokes model to really make sure that disability is represented to the extent that it needs to be. I want to ask if that's still being considered and what the current status is on that.
Laura, go ahead.
Thank you. Thank you, Megan. That was a wonderful question, and I really appreciate it. I did in my presentation share with all of you that we are in the process of developing an aging and disability resource connection, and that we are working with our partners in the community. Really, one of the things that we're very proud of is that the California Association of Area Agencies on Aging has been partnering with the Independent Living Centers of California and offering and bringing us together to train together. We literally just had an event on behavioral issues and aging and disability last week. That was incredibly wonderful for me to participate, and I think that folks that attended really enjoyed it. I still think there's a lot of work for us to do and to align those services tighter together, but I really do appreciate your bringing it to our attention.
Thank you, Laura. So I'll go over to the Q&A. There's a question here. I'm wondering how the AAAs in these regions think about supporting older adults who have moderate incomes and do not qualify for most public services, but who cannot pay privately, the missing middle. So I guess maybe if we can talk a little bit about how this hubs and spokes model, maybe both Laura and Paul, if you guys have any comments about how individuals that are like the missing middle, like how they're describing.
I'll take a stab, and then Paul, you can go next. We are looking at economic insecurity as a major focus of the work that we're doing in Los Angeles. I really appreciated Paul's comments around the increasing risk of homelessness. That is something that we have been painfully aware of and trying to address. Economic insecurity is a major part of that. To the degree that older people do not have ways to afford aging well in place, it creates a higher level of risk. So we are actually working on multiple levels trying to address, what are some of those things that predispose older people to becoming more financially insecure. It's not just the cost of housing or healthcare. There are lots of other things in their life. For example, one of the areas I've been looking at and doing a lot of deep diving is how is it that 75% of people in Social Security are using payday loans, which tremendous fees that really predisposes them to a whole bunch of problems, situations that could potentially make them end up on the streets. So we're looking at that as a community and coming up with solutions. I can tell you one of the programs I launched a few years ago was a paid job training program for homeless older adults. Everybody told me that nobody would participate. Well, guess what? Not only are they participating, we are seeing remarkable success in older people transitioning into permanent housing and into unsubsidized jobs. So we are seeing that, that we have to really blow the boxes, the silos, and start thinking very differently about how to respond to the needs of older people in our communities.
No, and I would agree. I would agree with what Laura said, and I think it's important to note. I mean, when my remarks were focused on the folks we work with who are making $12,000, $13,000 a year, but I think it's important to note what the elder index tells us is what I think is just over $27,000, $28,000 for California is what an older adult needs to meet his or her basic needs. And in some of the urban areas like San Diego, like Los Angeles, like San Francisco, it's even higher than that. So when you look at even if you're getting the high end of Social Security, you're barely clearing what the elder index says you need for basic needs. So we do have to recognize there's a lot of people that you would say on the surface, maybe they're making $40,000, $50,000 with some pensions, investments, and whatnot, but they're not living comfortably. They're getting by. A lot of people are house rich, cash poor. So I think making sure that our programs do address that, and I think things like meals programs are critically important to augmenting some of that. I also think the job training and job readiness is part of that for folks that want to go back to work. Historically, the workforce training programs focus on getting people back to where they were, at the height of their professional career. I mean, and we've looked at that here in San Diego. which is great if you're 55, maybe 60, but if you're 65 or 70 and want to get a part-time job, maybe to help augment with $400 or $500, $600 a month, the system doesn't help you. And if you are suffering from issues of, let's say, digital divide, where you don't have access to be able to upload your application, you're not even able to apply. So I think bringing in issues, looking at digital divide, looking at job readiness, looking at ways that we can augment, and remembering that just because somebody appears on the surface they have more income than the folks living at the poverty level, that they do need assistance.
So I will take the next question. It's for Paul, and someone wanted to know if the research you were referencing is available online.
Yes, it's on our website, servingseniors.org. People can get it. I'm also happy to forward it to someone at CDA if they can distribute it to folks. It's available as a PDF as well.
I'll go ahead and ask another one. This one's for LA, for Laura. Where does LA place HICAP? Ombudsman program is shown separately in the spokes, yet they are a AAA program. HICAP is part of the AAA services, yet contracted, and it's not shown.
And that's my apology. I think I was rushing through creating the little wheels. I'm not very adept at that, so I apologize. The ombudsman, I checked and it's in there, but I left HICAP out. We actually have a lot more programs than are included there. I was just trying to show a sample for the audience of the wide array of services that area agencies on aging are responsible for. But thank you for letting me know. I will modify it.
Okay, let's move over to, we've got a few hands raised, so let's go over to the lines for a few questions, and then we'll move back over to the Q&A queue. So let's start with Katie Brandon first. We'll unmute your microphone.
Hello, I'm Katie Brandon. I'm the Executive Director of Pasadena Village. And so we're a small nonprofit, and I just wanted to ask that small nonprofits and villages throughout the state of California are brought to the table in these conversations.
So here is a comment. To address the case manager issue, I would recommend partnering with local nurse advocacy agencies to assure experienced and clinical care managers are used. My agency is in Coachella Valley, and I am looking forward to collaborating in this area. Thank you for that comment. Here's a question. How do we handle the need to have the emergency and new housing accessible? Is it emerging maybe to have emergency and new housing accessible to people with disabilities?
Well, I guess maybe take a stab at it. I mean, I think that all new housing, has to follow ADA standards. So as a housing developer, we're required. That is a given. I think the issue is more with shelters. As I alluded to and was raised a couple of minutes ago, that a lot of shelters, attempt to be ADA compliant, but you're still quite often, you may be dealing with a tent, you may be dealing with a old gymnasium, less than optimal conditions, where restrooms may be quite a distance away, the eating area may be a distance away, and so that's partly why we were suggesting that you need that shelter within a shelter concept, where you design an age-friendly environment that obviously would include folks with disabilities, could be absolutely included in that, where there's a little bit more attention to some of those details. But I would agree that overall, looking at basic shelters, it becomes a challenge when you're trying to get people off the street and finding a place that meets all of the requirements, but it doesn't mean you can't have an area that is specially set up to meet or to accommodate their needs.
I just want to add one of the things that we're doing in Los Angeles, the city of Los Angeles in particular, is that we're actually working with our housing department, our planning department, looking at existing ordinances and really evaluating, are there opportunities for us at the local municipal level to influence how we build housing in the future. One of the things that we're all looking at is accessible dwelling units, normally called granny flats, or and so that is a work in progress right now. How do we build affordable housing that's also supportive for older people? And we're also, I can tell you, as a result of the pandemic, we began to really do a lot of soul searching around how we built nursing homes and how will we build supportive housing environments for older people in the future that would address the needs of an aging population with the unique understanding of what happened as a result of the pandemic. So I think there's tremendous opportunity to work, both aging and our colleagues in the independent living centers and others who are interested in bringing those cross-sectionality opportunities to bear as it results in housing.
Yeah, and this is Mark Beckley. I just want to jump in. Earlier the individual from Orange County ADRC had asked a question about what we're doing to incorporate individuals with disabilities into the aging hubs and spokes conversation. This question is a great one. We did just last week actually hold a town hall with CFILC as well as SCDD to really talk about the needs of individuals with disabilities and how to better integrate them into the hubs and spokes initiative. And it was, a great conversation. I'm actually going to, Connie, if we could share out the link to the town hall to everyone in this group. But I do want to share, yes, this is not just aging, but it's, collaborative aging and disability effort. We want to make sure that we link to resources and provide better access to resources for, all populations.
Mark. So we have another question here about ADRCs. Wouldn't it make sense for the ADRCs as an existing no wrong door systems to be the hub in the hubs and spokes model instead of creating a new separate system? This kind of comes up in every town hall, and I think we just a little more clarification about ADRC, hubs and spokes. What's the difference? What's the similarities? Is it the same thing? Maybe both Laura and Paul, or even Mark, if you guys want to, particularly Laura, and Paul, if you guys want to talk about ADRC versus, the hubs and spokes, how does that work? How does it not work?
Yeah, let me start off and then I'll hand it over to, then I'll hand it off to Laura and Paul. I think this question does come up in pretty much every single town hall. And the way that we explain it is, we're really focused on this key partnership between the AAA, adult programs in the county as well as nonprofits, because we really see those as the foundation. The stronger that a AAA is, the more connections it has, the better resources it has, the better it can actually help equip and support an ADRC. So if you think of the AAA as sort of your base layer, that ADRC then gets layered on top of it. So absolutely, we want to have a statewide strong ADRC system that can take in referrals, that can take in requests, and can do those warm handoffs. But really, to have to be a strong ADRC, you have to have that AAA and that ILC beneath it, positioned very strongly and with the right resources and the right connections to really bolster that ADRC. Laura, go ahead.
You said it beautifully, Mark. Thank you. It really is an and, not an either or. It's about building and layering and ensuring that I can tell you this morning I was sitting with my staff who were, responding to the California Department of Aging on our ADRC. And a lot of what we're looking at is relationships. How do we build bridges? How do we communicate more effectively? How do we ensure that as the client is identified to us, that at every step of the process, we can stay holding hands with them, as it were, to make sure that they're getting the services that they need, and that we have ways of being able to track that, to communicate with each other, and to ensure that everybody is on the same page with the client's expressed needs and also desires. So a lot of our work as a AAA, as working with our partners in the independent living centers and our extended partners, is really how do we mobilize all of those networks in a coordinated approach. So I think it's an and that we need both approaches, both frameworks to fulfill the vision of aging well in place and to be very inclusive and very accessible to all that need it.
And I think both Laura and Mark said it well, so I'm just going to associate myself with their remarks. I don't think I can add anything.
Here's a great follow-up question. A successful hubs and spokes framework seems dependent on strong collaboration and communication. One of the significant barriers to service providers working together to assist an individual is the ability to share data. How can we legally among county and non-county stakeholders to create a multidisciplinary approach when regulatory or statutory guidelines on confidentiality are in place?
I would associate myself with those remarks as well in terms of agreeing. That's a major challenge. You know, you do have CIEs. I mean, you have some ability to, you know, to share information, but at least I would say from a local perspective, we end up doing a lot of it ourselves, and you know, we share the data through the, you know, for instance, on our meals through the queue system to the AAA, on to the state. So developing a simple, easy to use, perhaps software designed in the 21st century approach to some of these solutions is absolutely necessary and it needs to be a priority, because it's really not, it's not happening right now.
You know, what I'll share is, you know, as somebody who's been doing this in the public sector for almost 30 years now, that we probably have a lot more functionality than we actually understand. And it's really important for us to look at the Welfare Institution Code, the different codes that are out there, HIPAA, et cetera, because oftentimes what I have found when I talk to lawyers and city attorneys and county councils, even the state attorney generals, we are able to get opinions that actually support the good work that we need done. Many times it's almost a self-limitation that we just believe that we can't do that. So as a kind of a bit of a troublemaker, I'm going to say that as a group of advocates, we need to start challenging and pushing back and saying, show me where it says we can't do that. Because too often we deprive our clients of services they need without ever asking that question. It's an assumption we cannot communicate. There are real limitations, I understand, and we need to safeguard client confidentiality and client decision-making capacity. But too often, we actually impose a meaning to something that is not there. So let us also, as a collaborative of people who care about persons with disabilities and older adults, we need to start pushing back about what is it that we can do and what is it where we need legislation to inform our ability to work as partners with our clients to meet their needs. So consistently, I have found that no one ever asks, can you please give me an opinion about this? It's really critical that we do that a lot more. And I think with our partners at the California Department of Aging and others, we can do that.
Yeah, and this is Mark Buckley. You know, at the state level, I would say this is an area where the state's really starting to work towards trying to break down some silos and break down some barriers. So within Health and Human Services, we had what's called our Open Data Initiative, where we started creating a portal, a repository where all sorts of health and human services data has been shared. And we've been going through some legal opinions about what can be shared across state departments and what can't be. There's also the Health Information Exchange Initiative that was recently launched, which also looks to do greater, sharing of health information across programs, right, and among providers. So I think that's another very promising and encouraging initiative. But I think that, with the master plan on aging, we're collecting more data on aging and disability than we ever have before. I think that we're going to keep pushing the envelope in terms of what we can get and what we can share out. So that's something at the state level that we're going to continue to work on. And then the other part to it is, of course, having like open freeways or highways that this data can travel along, kind of the point that Paul was getting at earlier. And that's something that we hope through this sort of like one computer system that I talked about, this, what we call our client relationship management system. If we can get all of the AAAs on one single platform, we'll be able to get local data faster. We'll be able to really use that to our participants' benefit and hopefully improve our programs faster. So over the next 3 years, we hope to get that universal platform implemented.
Mark, let's go over to a raised hand really quickly. Gregory Mathis, we'll unmute your mic, or if you can unmute yourself.
Good afternoon, everybody. My name is Gregory Mathis. I'm with Community Health Initiative of Orange County, and we're a partner with the ADRC in Orange County. And this is really exciting, talking about how we're going to be sharing information and making cross referrals to support older adults and persons with disabilities. It raises significant issues, though, for me in terms of the challenges that lay ahead for us. And I certainly don't have any quick solutions, but I thought I would bring up a couple of questions. So, for example, there's lots of competition for these competing platforms. So how do we find a balance between the platforms and local control and state control? For example, in Orange County, at the moment, we have Unite Us, the CIE system from 211, Aunt Bertha, the county's working on a system, and we have our own customized system, so to speak, with the ADRC. So there's a lot of competition. So that's my first question. And my second question is, how do we find a balance between local and state control when setting up a system like this? Thank you.
That's a great question. I'll sort of answer that at a high level. Through our CRM or client relationship management system, that's questions we're starting to ask. We have met with Unitas and other referral providers, and we've really been sort of thinking through how do all these different platforms relate to one another, and where do they overlap, and where do they provide a net benefit. So at the state level, we're trying to untangle that, and at least our process has been, when we're evaluating and trying to select the best solution, is to really incorporate our partners into those discussions. So with the discussion around our client relationship management system, we got a group of AAA directors and staff to help us determine, evaluate what platforms would work best for our business needs. And then we're going through the same process with our ADRC partners currently. So, I think it's, really a true partnership, right, between state and locals to determine what sort of like universal platforms to use. At the local level, of course, that's, sort of a whole other situation where you interact with so many different departments and providers. And I can imagine it can be extremely challenging determining how to share information and through what tools. But I'm sure, Laura maybe has something to add to that.
I can tell you that's something that we actually have a request and an approval from the California Department of Aging. The city and county of Los Angeles have established part of a shared vision to create how are we going to manage data so that we can demonstrate impact of our work and have it be seamless, because we really we aspire to no wrong door. And Mark and his team up at the California Department of Aging have been incredibly supportive of working with us to move in that direction. And I can tell you it's both frightening and exciting all at the same time, but it's steps that we have to take. This is the next frontier. How will we make sure that we're leveraging the important information that we need in order to support our clients in their needs? At the end of the day, that's what's more important. How will we make sure that that information supports their independence and their capacity to make informed decisions?
And I would jump in. I mean, for us as a service provider, data is critical. I mean, we track everything that we do. I mean, literally, everybody that comes in has a card with a code. So if they get a meal, we can track it. If they're getting the exercise class, we're tracking it. But I think being able to, access information back to us is a missing element right now, particularly around nutrition. We've jury rigged it so we can at least have our case managers know if somebody is getting a meal or not. But I think being able to have shared information so that we can set proper metrics and be able to do proper evaluation of what we're doing so that we can go improve our models and hopefully be able to access additional funding. I mean, at the end of the day, if we can prove it, we got a better shot of getting it.
Here's another question. Seniors and people with disabilities are typically over-assessed by county systems. Are there any plans to develop a universal assessment that could be shared interdepartmentally? The form could also be a smart document that could prompt the No Wrong Door staff person filling it out to other services and resources that individuals could benefit from.
Yeah, I'm sure, several on this call maybe where the state's sort of, repeated attempts over the years to attempt to create a universal assessment. And it's something that I think everybody desires, and would think would be a great idea. But, it's so challenging because when you look at the different programs and the requirements and the different needs, it gets extremely complicated. So, I think this is something that, from a state level, we're going to continue to try to build towards, and I'm sure at the local level continues to be, of interest. Perhaps, it starts with on a program by program basis, trying to streamline and, create truly effective assessment tools, and then gradually build towards something that maybe would be universal assessment. But yeah, that's absolutely one of those, really key ideas that lots of stakeholders have put, a lot of time and thought into. And we haven't quite got there yet, but at the same time, we're not giving up. I think, yeah, it might be an incremental approach, but hopefully we'll build towards that.
Well, I can add, we attempted to do something at the local level for our agency. We have a collaborative partner that has a dental center in one of our facilities. And so we attempted to come up with an assessment that would cover dental needs as well as other case management needs, as well as nutrition, and sort of a no wrong door that someone coming to the dental center who needed social services could get them and vice versa. And we're fortunate to have some funding to be able to do it. And we came up with something, but it became unwieldy because, someone wants to add, just one more question here, one more question there. And so the challenge was coming up with something that was streamlined, that was useful, or something that was large and unwieldy and took 45 minutes to go through. And the person sitting there says, all I want to do is get my cavity filled, and you're making me go through 45 minutes worth of assessment. So I would agree, it's one of those conceptual things that makes sense. The challenge is how to have a one size fits all, given all of the needs. We're working on that in the homelessness arena right now here in San Diego. As I mentioned, the VIASPA data is a poor assessment tool for older adults. And so through the Continuum of Care board, we're looking at how do we come up with something that's a little more age friendly in terms of getting resources. But that's a narrower assessment concept that we're working on.
I'm going to be a little provocative, and I'm going to say that it's really about staff training and capacity building in our systems of care, less about forms and how we collect data. I've done all of the above in the past, trying to solve to that problem. And as Mark said, it's incredibly challenging. It's aspirational. And I think we need to I can tell you periodically, I take all the forms that we use at the Department of Aging, and I ask the question, who owns this data? Why are we still asking that question? because I think that that's also part of being good stewards of our staff time and our resources. But I also have been convinced that in working with older adults in the community, trying to do, comprehensive physical, social, and psychiatric assessments, that the critical element, and I've actually had people evaluate this, the critical element is the staff skills. If they are able to truly evaluate an older person's situation. So it's less about the data you're collecting and more about the process of how we are engaging with clients. So the data is critical, and it cannot be underestimated how important it is, especially when we're communicating with other systems. But I want to speak to the tremendous labor force challenges that California has in order to ensure that we have adequate care for the older adults that we're serving. Most of the people that work with older adults are woefully untrained to do the work that they're doing. They're woefully untrained to work with persons with disabilities. And we need to start paying attention to the investment that we have to make in our human resources to be able to make sure that they are able to provide the services that our clients need. Thank you.
Well, if I could actually just follow up too with that. I mean, this goes back to when I was on the Commission on Aging, visiting particularly some smaller sites, some rural sites. And not only was it the training, but it was the equipment, where people were proudly showing off the 7-year-old computer that had just been donated, and that was an upgrade. And so it's both the training, but investing in the technology, and again, having people join the 21st century in terms of capability.
Great. We've got a question here. Is the Hubs and Spokes framework supposed to support and build upon the AAA, on what the AAA is currently doing, or will this fundamentally change the AAA structure in planning and service areas across California? Will there be an analysis on the recommendations that will come out of these town halls on the impacts of AAAs? And will there be resources available at the local level to implement the Hubs and Spokes? I'm wondering, Laura, maybe if you can give us your perspective on, I guess, how it was done in LA in terms of how, how did it support and build upon the AAA? How the analysis was done, how did you guys implement a Hubs and Spokes model, and what resources were needed?
Well, I guess I have to correct the assumption. My assumption was as AAAs, we were always doing Hubs and Spokes. So I'm going to put that one up front. So our work has really had been to align the two area agencies because, we were separated at birth about 40 years ago. And I think it's been a negative impact on our community. So a lot of the work that Los Angeles has been doing over the last 4 or 5 years has been, how do we bring the area agencies to align closer together? We have always assumed that it is our responsibility to coordinate the services that we deliver on behalf of clients and with clients in the community, to identify new partners, emerging trends in our community, and basically be prepared to address them. So for us, it hasn't been that we had to invent Hubs and Spokes. That is the framework that we use always in the work that we do. I think that what the California Department of Aging is trying to move us towards is a more comprehensive definition of what that means. And so, we're delighted to be working as partners with the department in trying to re-envision and reimagine how we can be even more effective and more efficient. That's why I brought it the issues of, the human capital that we have to invest in. And Paul was saying we also have to invest in the infrastructure of how we deliver those services. And so I think all of those things are part of this framework. And I'm looking forward to working with our colleagues across the state to really create the standard for the nation.
Yeah, and this is Mark. I'll just maybe hit on the other points raised in the question. I mean, first of all, in terms of the AAA structure, I mean, in some cases, like in LA, they have a very solid and strong structure. I think what Laura and Lorenzo and LA County are attempting to do is, sort of expand their services, strengthen them into other areas. So in that case, I mean, it's really not a matter of changing the structure at all. It's keeping that structure and building upon it. And I think that's the situation that, probably all AAAs will find themselves in, right? Where they'll have really strong partnerships and collaborations with certain partners and providers. And through the hubs and spokes model, they would continue to strengthen those partnerships. And then through ADRC, they'll have that sort of like true one door that people can come in to connect with all those resources. In terms of the CDA going to do an analysis, well, absolutely. I mean, once we receive the recommendations, we've committed, we are going to share that out with everyone, all of our stakeholders. And we will do an analysis in terms of what recommendations, may be feasible, what might not be feasible, and we'll have discussions with our stakeholders along the way. And then resources available at the local level to implement hubs and spokes. Sure. I mean, if the, analysis bears out that, the system, could use additional resources to effectively implement, that's definitely, discussions we'd be having about, funding. And that's always been part of this initiative.
Mark and Laura for answering that question. So we're almost up on time, and we know that we still have some questions and comments in the queue. And there's probably some others that I'm sure that a lot of you guys have that haven't been able to answer. So what we can do is we encourage everybody to take the online survey. In the survey, here's the link. You'll be able to find it off of our website. If you go to the CDA homepage, there will be a link directly to the Hubs and Spokes initiative. There's a survey link there that you can follow the prompts to answer some questions. We'd really love your feedback, regarding any of the town halls, any of the discussions that we've had. This is really the time that we want to hear from everyone. And again, we want to reiterate that there have been no decisions made. These town halls are really meant to be engagement opportunities so that we can hear from everyone. And we understand that every region was also unique as well. And there's some different challenges that may be posed. So, piggybacking off of that last question, if there's resources that are needed, we'd like to really hear about them. We want to hear about all the comments, all the resources, all the suggestions. And that's where it's all going to be collated for the December meeting. The December results and recommendation briefing meeting is not a decision meeting. It's a meeting where we're aggregating everything and talking about main themes and things that we've heard and how we move forward on recommendations that may be coming out from all of these town halls. So we really encourage you to take the survey, submit your feedback, comments, and questions through that. If you can't access the survey, we welcome you to also send it to us via email. You'll find the email address as well on the webpage. So with that, I will close it off. Thank you everyone for attending. And again, if you have any questions, there's the email address on the screen. Feel free to email communications@aging.ca.gov. Thank you, everybody. Have a good afternoon.